Hello, my name is Maria and today I will demonstrate the Foley catheter, the insertion of Foley catheter. And first I have to check the doctor's orders to see what he will recommend and to see if it's any narrowing of urethra and any other additional information and the number of the catheter, the size of the catheter as well. And after I will check, I will wash my hands and I will enter the patient room. I will provide privacy and I introduce myself. My name is Maria and I will be your nurse. And may I have your benches, please? And I'll check. May I have your name, date of birth, please? Okay. Thank you, Mrs. Honey. Thank you. And do you have any allergies to iodine or seashells? No. Good, great. Do you have any allergies to soap or any other allergies, non-allergies? No, great. And the doctor recommends us to insert a Foley catheter, in order to help you to pee because of the urinary retention. And do you have any questions, or are you okay with the procedure? Okay, you are okay. And before we start, I would like to check your abdomen just to see the distension of your abdomen, if you don't mind. Okay. And of course, I can put the rail down. If the rail is up, I can lift up the bed to my level. And I will remove and I will palpate. Okay. Yeah, palpate. Good. Okay. Okay. And now I will prepare all the materials. I should have the Foley catheter tray to be sure it's intact, the expiration date that is not damaged, the number of the catheter to be sure that is the right number, which the doctor recommend, and everything is good. And I should have the towels, I should have the blue pad, I should have small towels, I should have a basin with the water and soap and gloves and alcohol and tape and everything ready to go. And what I will do, I will wash my hands and I will put clean gloves. Okay. Okay, I will have the soap and I will have the towel, warm water and soap. Okay, and I will lift up the bed to my working height, and I will put the patient on supine position. I can put a pillow under her head to make her comfortable. I will remove the sheets and the blankets, and of course I will ask her to flex her knee and like this, and the other one. And I'll put the gown up in order for me to be visible. And what I will do, I will have a blue pad and put it under the patient and just tell her to lift up her buttocks and just put it nice, organize it, everything. And then if it's an older patient, I will put a towel under her buttocks to lift up, and will be easier for me to introduce the catheter. And what I will do, I will tell her to lift up her buttocks and legs and put the towels, and everything will be nice and neat. And now we'll take the rag, rinse it with a soap, and put it around the hand nicely, and with one hand part the labias and to see the meatus nice. And I'll clean the fa labia first from top to bottom. I will rinse it and rinse the labia. I will rinse it, I'll put soap, I will clean the near side from front to back, then I will rinse it and I will rinse the near side, then I will wash it, put some soap, clean the meatus and the middle part from top to back. And I should not go back and forth, just from top to back. Rinse it and then from top, from front to back. And that's it. Then I will cover the area. I will take my gloves off. Okay, put it in the trash. I have a trash beside the bed. Remove this, the water and the water with the basin. And I will wash my hand. Okay, wash it one more time. And by the way, I should use the light if I don't see well the meatus, because it will help me to see it better. Okay, I wash my hands and I'll double check to be sure that everything is okay and it's ready to go. I will open it carefully and put my hand in. Put it on the table. Be sure that the table, this is trash. I can put it in the trash. I'll use this bag as a trash beside the bed. And I'll put it here. Be sure that the table is clean, that everything is ready to go. And I'll wash my hands one more time. And I will open the tray. And I'll open the file first, then the siding, the other side, and then the side close to me. And be sure that I will square it. Just touch it the 1 inch outside, because that I can touch it. That is not considered sterile. And then what I will do, I will crane in and take my gloves and the pads, very careful, without touching anything sterile, and put them on the table. Okay, I will take, I have the pad, and the shiny side should go outside. Be sure that I will not put it around me, touch any sterile, put it around my fingers, and then come and put it under the patient nicely. Okay, good. And now I don't need this pad, is for the male side. And now I have the sterile gloves, and be sure that I have enough. I will wash my hands one more time to put the sterile gloves, and open my gloves, and I will put it here on the table. I will open the sterile gloves. Be sure that I don't touch, only the siding. And just open them nice, and be sure that the cuffs are towards me. And now I can get one gloves and put it on. Good. And then I'll put the other one. Good. Don't lift the hands above my shoulder. Don't put them below my waist. And this one I can do it like this and put it on the floor. Okay, now I'm sterile. I can touch the tray, and okay, I have the iodine. I will open it and put it around on top of the cotton balls. Okay, and put this in the trash. Okay, I have the lubricant. This is the lubricant, and I will put it here in order for me to lubricate the catheter. I will put it there, and then I will put it in the trash. And then I will take the tray and put it beside. Okay, and I'll take the Foley catheter, and be sure that I will remove the plastic wrap, and when I remove it, that I still keep it sterile. Okay, that I will not flip it around and not be able to keep it sterile. Okay, and of course this can be in the trash. And then I have the syringe with sterile water. Remove the cap. Okay, and attach it very well. Put it in the trash, and I will attach it to this green port and touch it very properly and put it back. Good. Then I'll put the top of the tray on top and move the tray in the middle. And now I have to lift it up carefully and put it between the legs of the patient. And take it carefully. Okay. Now, with one hand, I'll separate the labias, and in order for me to see the meatus, and I'll put the hand and I'll separate it nicely. Then I'll take the cotton balls with the iodine and clean the far side of the labia very well from front to back, and then take it and put it in the trash. Take the other cotton ball, clean the near side from top to bottom, and then put it in the trash. Then take the cotton balls and clean the middle, the meatus very well from front to back, and put it in the trash. Then take again and do the same movement from front to back, and then put it in the trash. And one more time from front to back and put it in the trash. And then I will take the top of the tray, leave the hand there, don't take it, and put it here beside. And now I will take the catheter, and when I will take the catheter, be sure that I will put it in the be sure that by the way, the clamp, I can put it in the trash. I don't need to put it back. It's still sterile, but I can put it there. And then I can put in the lubricant and dip it in the lubricant very well. And then don't keep it too close, don't keep it too far, and then start to introduce it slowly. And I introduce it slowly, and you walk with the fingers backwards, and you walk and walk. Okay, and now as I see the urine coming, and I see the urine, I'll put it 1 more inch in. Okay, I put it 1 more inch, and now I will take my hand and secure, but be sure that I keep 1 inch sterile between the meatus and my other hand, at least 1 inch, and I'll put it here, and then I'll take the syringe and introduce all the water all the way, slowly. And now what I will do, keep the syringe there. With one hand I pull the catheter until I feel the resistance, and after I will feel the resistance, I will just advance it slightly in. Okay, good. And then with my hand I will come and help out and detach the syringe, and I will put it in the trash and take the tray and put it in the trash as well. And now I will remove the gloves, and okay, put them in the trash. I will wash my hands and put clean gloves. Okay, and now what I will do, I will take a tape and be sure that I will secure the catheter on the top of the leg of the patient. Okay, and be sure that the bag will not go will be below the bladder, but will not be on the floor. Will be attached to the bed frame, not bed rails, the bed frame to the more stable frame of the bed. You attach it there and be sure that it's unclamped, that the urine is coming, it's flowing nicely, everything. And then you take the trash, remove the trash, remove the blue bag, take the towel under the patient. Okay, make the patient comfortable, put the gown down, cover the patient, put the bed to the lower position. You can lift up the head, make her comfortable, put the call light, put the bed, the table beside her with a book, with the water, and picture that Mrs. Honey, please do not pull on the catheter and keep the area clean. And the bag, the collecting bag, should not be on the floor. All the time should be attached to the bed. Do you have any questions? Do you need anything else? No. Good. Then be sure that I'll put the rail back, the bed rail up, the bed to the lower position, that everything I will clean, put everything in the trash, put the towel in the linen basket, and just clean everything. Take my gloves off, put them in the trash, wash my hands, and I will document the procedure, the time, the urine, the color, if I had any trouble with the insertion of the tube, everything to be documented. Thank you.